Hello, my name is Ian MacLeod. I am a consultant in critical care in Aberdeen and I'm one of the Scottish regional clinical leads for organ donation. Over the next 10 minutes, I want to speak to you about some recent changes to organ donation in Scotland, specifically around the introduction of the Human Tissue Authorisation Scotland Act earlier this year, to think about some of the lessons that we're beginning to learn and how those impact on you as clinicians and the patients that you look after. The background to this is that despite all of the work that we've done over the past decade to improve both donation and transplantation, our numbers are remarkably stuck. There are still around 500 patients actively requiring a transplant today in Scotland, and our donor numbers remain around 100 to 110 per year. Trying to move that forward, we're looking at other things that can be done in order to continue to make improvements to improve the life of patients who are waiting for an organ transplant. And part of that is to look at the legal framework which supports donation in Scotland. You'll be aware that earlier this year the Human Tissue Authorisation Scotland Act came into force, and that brings some new concepts into play which we're now working with. The first of those is deemed authorisation, and that really is bringing us in line with the rest of the UK. All of the devolved nations are now either actively under a deemed situation or working towards it, as are many other countries in Europe. As well as the deemed authorisation, we also now have a system around duty to inquire what someone's last known wishes or decision was, and we also have a system of pre-death procedures in Scotland. I'll cover some of these later in the talk, but I suppose this is all really part of a degree of societal change. We know that society is generally supportive of both organ donation and transplantation, but we also know that many people do not find themselves in a situation where they're ever able to become an organ donor. And so it's really important that in the cases where that does happen, that we do support the person's wishes. It really is trying to put the person at the centre of this whole piece. It's about their decision, it's about what they would want, not what their family would have wanted, not what healthcare workers round about them would have wanted, but the person's known wishes and a framework around those. So the public has seen over the past year a publicity campaign which has asked them to think about donation and what they would want after they die if they find themselves in a situation where they can donate. They've been asked to record that decision on the organ donor register, and we know that this has worked. Today, 51% of the adult population in Scotland has opted in or signed the organ donor register, whilst less than 3%, at 2.8%, has actively opted out. That leaves 46% in the deemed category who have neither opted in nor opted out. And it's our role, I believe, as healthcare practitioners to facilitate these decisions where at all possible. From a staff point of view, we've seen a training package. I suppose we've all heard the publicity as citizens of the country. We've heard the same messages on the radio and on the television as everybody else has. But we've also had specific training around these new legal frameworks to try and facilitate our knowledge and to allow us to support patients and families where possible. So I suppose there are four main things really to talk about in terms of what we've learned so far. The first is that the public are definitely more aware about organ donation. It's coming up increasingly frequently in conversations in ICUs, and it's coming up earlier and earlier. And often before actually as clinical teams we are ready to have those end-of-life conversations. Secondly, the duty to inquire is really becoming an important safety check. Nobody wants to act against somebody's wishes. We want to facilitate someone's decision where at all possible, and so checking in what the last known decision was is really important because we know that people change their minds. And my third point then, I suppose, is the importance of the specialist nurses in organ donation and specialist requesters, because they're around this every day. They're dealing with families, they're dealing with requests, they're dealing with sensitive discussions around the duty to inquire, and they have knowledge of how to proceed in a deemed situation, and they know about all the accepted categories and safety checks and caveats that are in there. As clinicians, we may see this once, twice, 3 times a year, even if we're in a busy unit. But in quieter units or places where we don't see as much donation activity, this can happen really infrequently. So the importance of the specialist nurses has really come to light, and I would commend them to you as a service to use around this in the coming months and years. My 4th point is that old habits sometimes do die hard, and we're still seeing clinicians going ahead on their own without speaking to specialist nurses. We are seeing clinicians approaching families without checking the organ donor register, and we certainly know that there are situations where the duty to inquire, for example, has not been carried out. It is of paramount importance that this process is followed. The public have been asked to make a decision. We have a law in place, and therefore we as healthcare professionals need to follow that through. We need to ask these families, we need to ask about their last known decision, and we need to give them the appropriate information to allow them to facilitate their loved ones' wishes. So ultimately, we do end-of-life care as part of our role. We know that it should happen in a non-rushed environment. We know that we should have appropriate staff who are well trained and have knowledge of the situation, and that applies in donation situations as much as anything else. As I've already covered the importance of the specialist nurses and specialist requesters, they do this every day, so please use them. In terms of accessing the specialist nursing team, the earlier that they get the heads up that you're going to be having one of these discussions, the better, because they can get there to support you. And the other thing, which we're seeing increasingly commonly, is the idea of having to almost park a conversation to say to a family, look, we're not quite ready to have this discussion yet. You're maybe further ahead than we are. It's the form of words that you use to allow that conversation to be put on pause until the clinical team is in the right place to then have that discussion. It's not being about being underhand. It's not being about trying to do something against the patient or the family's wishes. It's about getting the right people with the right skill set to make the right decision and to help that family come to terms with what happens next. So in conclusion, I suppose I've tried to give you a bit of a flavour about what's happened over the last 6 months or so. The public is definitely more aware about organ donation, so you're going to hear it coming up in conversation more and more. This is cultural change, and cultural change takes time, and it was never going to be a situation that we went from where we were to where we're going to be in the future. There was always going to be steps in the meantime. The biggest piece of advice and the biggest ask I have of you as a clinical community is to use the subject matter experts and to allow the family to not make the final decision. It is about the person, the patient's wishes. That's the bit that we're trying to facilitate. And it's about trying to support everybody to allow, no matter what that decision is, it's to allow that person's decision to be fulfilled at the end of their life. My final point would be around further training and where you get further information and help. I would always start with your local specialist nurses in organ donation or your local clinical leads in organ donation. There's the online TURAS e-learning module, which if you haven't done, I would certainly recommend, and I'm sure we'll be back in touch in the future with further updates. If there's anything else I can do, please feel free to get in touch. And I thank you very much for your time.